my name is Mary Ann Blackmer, and I'm the Community Outreach Program Manager for Brigham and Women's here in Hingham and the South Shore. And I'm here today with Dr. Peter Grape, Chief of Brigham and Women's Harbor Medical here on the South Shore, to learn about the past, present, and future of Brigham and Women's Harbor Medical on the South Shore. Thank you, Dr. Grape. How are you today?
I'm great. It's a pleasure being here, and thank you for asking me.
It's very exciting. I can't wait to, there's so much history, I think so much more than people realize. So the point of this interview really is to let people know Brigham and Women's Harbor Medical has been here on the South Shore for quite a while. We have great collaborations, and you tell the story so wonderfully. You can take it from here. If you wouldn't mind telling us first a little bit about yourself.
Sure. So thank you for asking me. My name is Peter Grape. I'm a cardiologist by my training, board certified cardiologist, and as such I'm also trained in internal medicine. I joined from my training down into the South Shore and joined two other doctors at that time, and this is back in 1984, believe it or not, that long ago. And the three of us started a group called Cardiovascular Health Associates. So a little bit of the history of Harbor, if you want to hear about that, and that will, and it won't be too long, but give you some sort of sense of where we started. That was the start of our organization, the three of us coming together. We quickly grew to 7 cardiologists, and then at that time we decided that it made some sense to become multi-specialty. So we added other specialists, a pulmonologist, an endocrinologist, and then we started adding primary care. The rest, I would say, is history. And over the course of the next 30 years, we grew, and I'm going to say that predominantly I was overseeing it administratively because I just enjoyed doing that, and I continue to practice full-time. But we grew to about 60 doctors, and we added a lot of other services during that period of time. So we ended up in the, I would say, in the last 7 or 8 years ago with about 60 doctors. About half of them were primary care, scattered throughout the South Shore. The other half were specialists in cardiology, gastroenterology, endocrinology, pulmonary, surgery, and neurology. It's a pretty complete group. In addition, we added a lot of other services, so imaging services, CAT scan, MRI, plain radiography. We added cardiac testing. We had an endoscopy center for our endoscopies, and we had a pulmonary center. So we did pulmonary function tests and sleep lab. And then finally, we added a full service lab. So that occurred over the course of a 30-year period. And that's essentially, to a certain extent, where we are today. Now, about 6 or 7 years ago, healthcare has been changing dramatically over that period of time, and there's been a huge amount of consolidation of healthcare among everybody, to be frank. So we felt it was important to be part of a larger network, just because it takes a lot of capital to grow and to create the services we wanted to. So we searched for what we thought would be a perfect partner, and we found that in the Brigham. And so in March of 2015, we joined the Brigham and Women's Physician Organization and are now owned by the Brigham. So to kind of end the story, what that's allowed us to do is continue to grow over the last 5 years, continue to add to our services, continue to tap into the specialty services of the Brigham, and I think become a much better organization over those last number of years. And that's where we are today. We have now about 70 doctors, probably about 20 advanced practitioners, and we continue to have all the services I mentioned, but we also are bringing in orthopedics from the Brigham and urology from the Brigham. We built several new buildings, or we've built one new building, and we've leasing another large building in Hingham. So it's been a very good experience with us.
So it sounds like you really listened to the needs of the community on the South Shore, and you answered those needs with all of that growth, because that's exponential growth in 30 years. I mean, to acknowledging that, you know, you could have went on your merry way with cardiology. So that's really impressive. So I know that we do have the building in Hingham, and could you tell what is in the Hingham location?
So our doctor locations are probably 5. So in Hingham is an internal medicine practice of 4 doctors and 2 what we call mid-levels. And it's right on the seaport, right on the harbor there. And so it's a great location. We also have a site in Scituate, which has another 4 or 5 internists and 2 or 3 mid-levels. And then finally, our Pembroke site is a very large site, which has just been built, which has a group of family practitioners as well as all of our other services, such as imaging, OBGYN is there, surgery comes and goes, and our urgent care centers in Pembroke. And then finally, our 2 last clinical sites are in Weymouth, which is the Stetson building, and that has a large component of both primary care and specialty care. All of our cardiology is predominantly there, but also in Pembroke. And then finally, we have our surgery and gastroenterology in Braintree. So those are our major sites.
So that's great. So I believe the Hingham site as well, located in the shipyard, is you also have lab there. So if you do go to Pembroke or one of the other sites and you live in Hingham, you can actually get your labs done there. And so the best thing I think about being a Brigham and Women's Harbor medical patient is that you can go within the different sites and it's all one system. So if you're signed up for Patient Gateway, you can see all the results immediately. It's really amazing, the technology as well as the providers. So Pembroke also, we have the mammography, so you don't have to go into Boston anymore. You can get everything done right here on the South Shore, which is really fantastic. Can you tell us a little bit about the relationship with South Shore Hospital?
So a couple of comments first is that what we found over the course of the 30 years is when patients came to us, this to your point, is they love the fact that when we said we're going to get you to see something else or do something, that we had it within our system. And they felt, first of all, some comfort in that, and then convenience in that. So to your point, the fact that we are all inclusive in the care that we give, ambulatory care, has been a very, very significant positive factor for the patients who come to us. Now, South Shore Hospital has probably been one of the major reasons we grew as quickly as we did. Predominantly because they are a significant part of the healthcare in this area, and they grew over the course of those 30 years, and because of their growth, we were able to grow. So I would say 90% of our care that goes into a hospital goes to South Shore Hospital. Obviously, if it's very complicated care or what we call tertiary, quaternary care, it will go to the Brigham, which is probably some of the best places in the world that it could go to. But if it's something that can be handled in a community hospital, or frankly in South Shore is even more complicated than a community hospital, we refer most of our care into South Shore. And it's been, frankly, a great relationship.
It's great because the doctors practice there as well, correct? The surgeons do surgery there. So for people that just understand the relationship, that I mean, a large percentage of our surgeons practice there, is that right?
So we have surgeons in Harbor, and they all practice at South Shore. In addition, Brigham has a cadre of surgeons, both thoracic, trauma, neurosurgeons, general surgeons, all of whom are predominantly working in this area and predominantly, if not exclusively, do their surgery out of South Shore. So yes, all of our surgery is done frankly, locally, if it can. Now, complicated surgery, such as bypass surgery, is done at the Brigham. Complicated neurosurgery is done at the Brigham. But frankly, if you can, we like to keep our care local.
That's amazing. Yeah, we had an interview with Dr. Bob Driscoll talking about the robotic surgery that he does at South Shore Hospital. So it is amazing the level of care you can get right in your community. It's world-class healthcare. It's amazing. So I want to just ask you a quick question because we're coming out of the pandemic, hopefully. How was Brigham Women's Harbor Medical able to take care of patients during the pandemic?
So I'd like to tell you I was clairvoyant by joining the Brigham because I'm not sure how much we would have been able to survive as a private company over the course of that time. But the Brigham has basically lifted us through that pandemic and helped organize us so that we safely take care of ourselves as well as take care of the patients and that makes certain that we have been able to kind of pivot, if you will, from face-to-face care when the pandemic was at its highest level to what we call virtual care. So we had the technology in place and the organization in place to be able to move our physicians so that we interacted predominantly with our patients during the peak of the pandemic virtually in a face-to-face video visit or over the phone. And that was a huge, huge help. In addition, the Brigham and Mass General Brigham, which is the parent organization of the Brigham, helped us organize patients coming into our office. So, safe care. We wanted to make sure that we were as safe as possible for the patients who needed to see us face to face. So we screened every patient at the door. We made sure that they all wear masks. If they were sick, we would divert them to a place where they could be more safe. We would make sure that all of our staff was safe. We used plexiglass to guard against any kind of infections or spread of the infections. And all that took place over the course of a very quick period of time so that we felt comfortable taking care of our patients in person when we needed to. That safe care commitment has continued and continues now and continues in all of our sites. So I think people and our patients feel comfortable coming to see us because they know we care so much about their safety with respect to the pandemic.
So do you think, you mentioned virtual visits, do you think that they'll continue?
So yes, at the peak, we were probably doing 20 to 25% of our visits virtually. That's down now to about 6 or 7% because patients, frankly, want to be seen person to person. But there is a place for virtual visits. I think there's a convenience factor in that, and there are certainly areas in medical care where virtual visits work perfectly. So absolutely, we want to be able to continue that aspect of our practice for now and into the future.
Thanks, Dr. Grape. So what is the future of Brigham and Women's Harbor Medical? Do you have any idea?
Well, so we're very fortunate to be part of the Brigham and all of their expertise. We feel this has really taken us to another level in terms of the care of the patient. What people need to understand is that the Brigham is part of a much larger organization that used to be called Partners, that is now called Mass General Brigham. And that's the parent organization that includes all the different community hospitals, includes Mass General and the Brigham, and we tap into that network as well because all of our medical record system is similar in that organization. So the parent organization of all of us is Mass General Brigham, and the only reason to tell you that is that you're going to start seeing that name on our buildings, in our signage, and so forth, because I think people have been confused in the past about exactly who we are. We're still part of the Brigham, but we're also part of a larger organization called Mass General Brigham. And so people will start seeing that signage and that on all of the places they go. So they're not confused. We're still part of the Brigham. We intend to be part of the Brigham for the indefinite future. But the whole organization is part of Mass General Brigham.
Great, thank you so much for that clarification. Sounds like through all the transitions of names over the years of Harbor Medical, Brigham and Women's, that one thing remains the same, and that is your commitment to patient-centered, world-class healthcare right here in our community, right in Hingham and the South Shore, and we thank you so much for that, Dr. Grape.
It's been my pleasure, and it's been extraordinarily important to us that we take good care of the patients, that they feel that they get the best of care and the best places. I'm not sure the name in the end makes a huge difference in this, whether we're Harbor or whether we're Brigham or Mass General Brigham, it's all the same. We are the same people, the same doctors they've visited before, the same services that we had all of the time before, and we'll continue to do that. And I'm actually proud to be part of Mass General Brigham, proud to be part of the Brigham, and proud that we developed an organization called Harbor.
Thank you so much. So for more information on Brigham and Women's on the South Shore, please visit brighamandwomens.org/Brigham South Shore. Have a great day, and please reach out if you have any questions.